So today I want to go over with you
some advice on what to do for yourself, your friends, and your family in the event that you need to go to the hospital for hospitalization to keep things orderly, aligned, and prepared. So number 1, research the hospitals in your area, and especially the hospitals that your provider is affiliated with, because you want to be mindful of where you would like to go in the event that a crisis happens and you're going to get sent to a hospital. You want to tell the ambulance or you want to tell your relatives that I want to go here and to be treated here. My best advice to you is to ask your community, ask your friends, and to see where they've received excellent care. Number 2, I think it would be helpful if you made a Word document and you were able to type the events by dates to see what had happened, where, how, and why. It should discuss the major and important findings in your healthcare life. Place that document in a hardcover binder so that wherever you go, if someone, like a stranger, finds you sick, or a stranger from the ambulance picks you up, or even a friend or a family member who's nearby and they see that you're sick and they need to send you to the hospital, have that binder at hand, know where it is, and tell them, go get that binder, bring it to the hospital. I want to share my documents with this hospital. Because sometimes you never know. You may be admitted to a hospital that is not in your area, not near you, and they need to know updated information on how to treat you. Because it takes time for providers to request personal information from your primary care provider from hospitals that you were previously admitted to. Number 3, and when something happens to you, make sure you or whoever's there to witness this crisis documents exactly what happened, when it happened, the time that it happened. For example, what were you doing at that time? What were you eating? Or how were you feeling specifically at that time? The provider needs to know this information so that they can correctly assess the events leading up to that specific point where you were urgently needed to go to the hospital. Number 4, document and list all of the medications you take, including supplements. Also, the medications that had previously been discontinued by your provider, you want to know or you want to write down the reasons why it was discontinued. Were you allergic to it? Did you have a bad reaction? The provider in the hospital needs to know this information. And again, document the medication list on a Word document, put it in that binder that I had discussed. And you know what? Maybe you need to make 2 binders. Maybe one binder needs to be at home in a safe place where you always know it's there, or possibly in the car, because an emergency event can happen when you're outside, outdoors. So whoever is there at that time, they have access to your medical records and exactly what happened to you or what has happened to you in order to treat you better and to be prepared to treat you. Number 5, prepare a list of all of the medications, supplements, and foods you're allergic to. That way, when healthcare providers are attempting to treat you, they know, okay, you're allergic to these medications, these foods, we cannot give you anything with those ingredients. Number 6, before you go into the clinic or into the hospital and you know you're about to be admitted, make sure you drink plenty of water. The reason is you're more than likely to get an intravenous IV, which is hydration through the vein. And the best way for a nurse to access the vein is for your veins to be plump and beautiful for them to stick a needle into and not miss. And in terms of location of where the IV should be placed, I'll give you a tip. If the nurse puts the IV in a place where you're bending, let's say your wrist or your elbow, these areas can bend the intravenous catheter that stays in your arm, and eventually it can occlude the fluid that's supposed to go in, which will cause the IV that is pumping the fluid into you to beep and beep and beep. So word of advice, if you go to a hospital and you want to have a peaceful night and you don't want to hear the machine beeping all day long, just simply ask the nurse, can you please put the IV in an area where it's straight, like the forearm, like the back of the hand, like the upper forearm, just not in the wrist or the elbow, because these areas bend and can cause problems in the future. Being disrupted by noise in the hospital when you're so sick, it's really dreadful. Number 7. So my advice to you is pack a pair of earplugs in the bag that you are preparing to go to the hospital. The earplugs may help you with the noise. In my hospital, there's a thing called sleep hygiene. Sleep hygiene is when the doctor makes an order into the system and it says specifically, do not bother my patient between 10 p.m. and 6 a.m. due to their need to get proper sleep. So wherever you go, whichever hospital you're admitted into, maybe you can raise this to their concern and say, is there any way for me to have adequate sleep? Can I not be bothered from certain hours of the night? However, if you're in critical condition, sure, why not? Let the team help you. However, if you're not in so much critical condition and you really need a full night's rest, just ask the doctor and they can put a sign on your door that says, no disturbance between the hours of this and that. Number 8, Have a list of emergency contacts available, and then select one person to be the main person of contact. We are going to discuss with them exactly what's going on, and that one person can disseminate it to all of your family or friends that you want aware of your situation. Start a group chat. Number 9, research and ask your personal care provider what an advance directive is. An advance directive is a document stating what you would like done for you. In addition, it has your emergency contact and who would be making decisions for you in the event of a crisis. Maybe you're not sick enough to have to make a decision in your hospitalization in regards to life and death, but to have this document at hand, at least this document has your emergency contact. And if something were to happen, we know how much we need to do to save your life. Do you need a breathing tube? Do you need medication to pump your heart back to life? All of these questions are essential and they come with risk. So speak to your personal care provider, talk to them about how risky each of these interventions are, and you guys can make a better sound judgment for your life. Number 10, prepare a duffel bag. Like I had mentioned earlier, get that duffel bag, put some earplugs in there so you don't hear the noise. Include some loose-fitting clothes like a large shirt, maybe a button-up shirt, maybe some draw pants with the drawstring, perhaps some shorts or some slippers. Slippers that have grip on the bottom so that you don't injure yourself or fall when you're walking in the hospital because you're feeling much weaker and your legs are not working like they should. In addition to items that you think would be helpful to you when you're in the hospital. For example, books that will entertain you, electronics, your favorite blanket and pillow for comfort, headphones to use on your personal device so that you're not bored to death or you need some relaxation, as well as specific toiletry you like. Maybe there's a specific wipe that doesn't burn your ass. And then you want to leave valuable items at home, like your jewelry, your wallet, your money. You don't need those items in the hospital. And if you do bring items to the hospital that are of value to you, we keep track of the items, write it down, just make sure you let the staff know that these items are in the hospital, and upon checkout, we will go over the list of items with you to make sure you leave with the items. But if it's taken in and out of the hospital because of friends and family, make sure you update the staff in regards to your personal belongings. Number 11, so that binder again, make sure you put the provider's names and their contact information in that binder. You want a list of all of your providers and their contact information. That way, if the providers in the hospital need to get an update from your providers and ask them questions, it will be very simple for them to gain access to that information. Number 12. Now, this is a long one. Keep in mind, the key to a successful recovery and non-delayed discharge from the hospital is having pain managed with oral medications, being able to eat properly, nutritiously, without suffering from nausea, being able to walk with or without a device, and having a caregiver for you readily available to you at discharge. And if you can't go home because you don't have a caregiver, then they have to talk about nursing facility placements. How do you fulfill all of these requirements before you go home? So there's a few steps you should follow. Make sure you use that breathing device that your nurse gives you. It's called an incentive spirometer. It checks the expansion of your lungs. So you're going to use that device, breathe in, and it's going to check how much air you're breathing in. It actually prevents you from getting pneumonia, and it helps oxygen circulate throughout your body to let you know you're breathing deep enough. Our recommendation, use the device 10 times every hour while you're awake. Take pain medication if you need to in order to move around normally, in order to use the device so that you can breathe properly. Because if you're not using and moving and using all of these equipment to help you go back to normal, then it may delay your discharge. The pain medication can be slowly tapered off. So you may have to have more pain medication at the start of your stay, but towards the end, you may have to use less. So don't worry. We will not give you enough for you to become addicted to pain medication. We just need to give you enough so that you're comfortable, so that you can participate in your own care and begin to use your body. Because muscle fatigue or muscle wasting is a real thing. So in order to poop, you got to keep in mind when was the last time you pooped, and then if it doesn't match your normal schedule, let's say it's going on 2 days, 3 days, 4 days, and you still have not pooped, you need to work on it. So the best thing to do is to drink some prune juice, look up the items that will help you with your constipation, walk around more, and if offered to you, take some laxatives. Take it so that you don't become too constipated. Because there's a problem called getting an ileus, where your stools get stuck in your intestine and then they don't move anywhere, which causes the bowels or the colon to end up dying. We do not want to get to that point. So movement, laxatives, and food that will help relieve the constipation will be your number one friend. Make sure you hydrate. Make sure you're peeing properly. And if you have a Foley catheter, the tube that goes into your urethra to help you drain your pee, after surgery or something of that sort, you need to make sure that you pee 6 hours after the removal of that Foley catheter. And the best way to find out is to drink water and to walk, go to the bathroom before 6 hours, and to try to pee. Well, hydration is your friend, as long as you're not limited to the amount of liquid that you can drink. And your provider will tell you this. Exercise, exercise, exercise. Make sure you move, get up, move around as much as you can. Take a little bit of pain medication if you need to, but movement is the key to healing. Set goals like, okay, today I will sit up on the side of my bed. Today I will sit up on the side of my bed and kick my legs and do some arm exercises. And then tomorrow I will walk around my room. And then the next day I will walk around the department. So you gradually work yourself up so that the muscles in your body do not waste. Number 13. So muscle wasting, again, can be a real problem. Due to inactivity in the hospital, it can cause you to injure yourself, to fall, and just to not move around like you once did. I would recommend purchasing workout bands perhaps that you can use while you're in bed and you're not moving around much to help strengthen the muscle on your arms, strengthen the muscle on your legs. And when you're overnight in the hospital, physical therapy is always offered to you. So take advantage of it. When the physical therapist comes to visit you, ask them, what type of exercises can I do in bed? What type of exercises can I do sitting on the side of the bed? What exercises can I do standing up if you're here with me to watch and to make sure that I don't hurt myself? Or just watch some videos before you enter the hospital so you know how much you can do. But then again, make sure that your provider knows you have these exercise bands so that you're not doing too much, and just ensure that whatever you're doing does not interfere with whatever you went into the hospital for. And last but not least, we have 14. Take a notebook with you to the hospital. This notebook would be essential to you and all of the stress and anxiety that you have. You will be able to write events down, write questions down, and to be able to follow up with the providers, because you have so many people coming into your room on a daily, what they're doing, what they're asking, and you may not remember the questions that you have for them at the time. And then all of a sudden, 15 minutes later, the question in your head pops up. You can write it down and ask the provider, and it will just make your life so much more simple because everything is organized on paper and you see it visually. All right, guys, I hope these tips and tricks will help you in the event that you get sent to the hospital, or you can share it with your grandparents, your parents, just to prepare them in the event that an emergency situation happens, because these are the tips that I've collected over the years that I've seen patients come in and not be prepared for. So prepare yourself and take each advisement as an opportunity to simplify your life. Okay, bye.